Iranian surgery, medical tourism at its best. Hello and welcome to another episode of Iranian Surgery Podcast. In this episode, we are going to talk about rhinoplasty. First of all, we are going to start with an overview. Man instinctively seeks beauty and desires to become more beautiful. With the advancement of medical science, it has become possible for everyone to change their face, the most important external organ of the body, and the showcase of communication with the outside world for each person, to whatever shape or form they wish. Rhinoplasty is one of the first and most common cosmetic procedures to improve the appearance of people, which is very popular in the world and especially in Iran. But let's hear more about rhinoplasty itself. During this process, the plastic surgeon changes the cartilage and bone of the nose to carve out a more desirable appearance. For men and women who are dissatisfied with the size and shape of their nose, we offer an effective and reliable cosmetic solution, especially when they entrust the work to an experienced and skilled cosmetic surgeon. Rhinoplasty can be used to change the shape, size, and overall appearance of the nose. Here are examples of common requests that patients have from their surgeons. Narrow the nasal bone, narrow or widen the nostrils, fix a deviated septum, change the tip of the nose, change the angle between the nose and the upper lip to correct structural defects, respiratory problems, for example. In most cases, the incisions used to make the change may be hidden inside the nose or may be indistinguishably visible on the nose. The overall goal is to improve the appearance and maintain a natural appearance in accordance with other parts of the face. We have to consider the age though, and by the research in 2021, the best age for rhinoplasty is 15 to 25 years old. But the question always remains, what method to choose? Regardless of what type of rhinoplasty the doctor prescribes for the applicant, one of the two main techniques is usually used. 1. Closed rhinoplasty. Closed rhinoplasty surgery is generally the preferred method because all surgical incisions are made inside the nose and the wounds are all inside. Although the incisions are hidden, the surgeon can still access large areas of the nose to handle a wide range of cosmetic and structural issues. Number 2. Open rhinoplasty surgery. This surgery allows the doctor more access to the cartilage and bones of the nose, but small scars may remain on the nose. In this method, by making an incision in the cartilage area between the nostrils, the doctor can lift the skin from the tip of the nose and shape the cartilage very precisely. After healing the incision, very small and almost invisible incision site remains on the nose. Nowadays, with improvement of the medical sciences, many are looking for the best method and routines for their rhinoplasty operation. For example, what factors to watch out for before rhinoplasty and what kind of actions to take after the rhinoplasty. Here we are going to talk about a few of them. Diet. In the weeks leading up to any surgery, it is important for patients to follow a healthy diet. Proper nutrition speeds up recovery and reduces the risk of infection. In particular, people should consume large amounts of fruits and vegetables. Grains containing protein, nutritional supplements are also helpful. Doctors might recommend certain supplements such as vitamin A, vitamin C, and bromelain to those who intend to have rhinoplasty. Medications. When preparing for rhinoplasty, patients should inform their doctors about all the medications they are taking, because some medications can cause side effects before or after surgery. Your doctor may prescribe a temporary safe alternative medicine for the patient. Smoking. The use of tobacco reduces blood flow throughout the body because oxygen cannot reach the incision site quickly enough. Smokers may need more time to heal after surgery and have a high risk of infection and unwanted wounds. Although smokers are not automatically disqualified from having rhinoplasty, they should quit smoking at least 2 weeks before and 2 weeks after surgery. Preparing for recovery. Recovery from rhinoplasty may take several weeks, and patients should be prepared based on how long it will take to heal. In particular, they should take at least 2 weeks off work and, if possible, find someone who can help them get on with their day-to-day activities for a few days. After rhinoplasty, chewing can be bothersome, so patients should eat soft food for the first few days. Recovery. Rhinoplasty takes several weeks to heal, and the patient must take specific steps to speed up the recovery and achieve the desired result. The first few days. Absolute rest is very important in the first 48 hours after rhinoplasty. Patients should keep their head up while sleeping. Wear open front clothes so that they do not have to wear them again. Apply a cold compress to the face. Eat soft foods that contain nutrients and fiber. Avoid showering and washing your face as long as your nose is bandaged. Replace a sterile bandage and gauze as recommended by your doctor. Typically, patients can return to normal life within 2 weeks of surgery. However, nose care should continue for a long time. Avoid strenuous exercise until your doctor tells you to. Reduce sodium intake to reduce swelling after surgery. Do not neglect the use of strong sunscreens. Do not wear glasses or sunglasses for at least 4 weeks. It is very important to follow up with your doctor in the first few weeks. The first appointment is usually 1 week after the nose job. Once the nose bandage is removed, patients will have periodic checkups after a few months. After your rhinoplasty operation, there will be bruises and swellings. So in order to see the final result of your operation, you need to wait 3 to 6 months to pass the time of your operation. You have to consider that you need to stay 7 to 10 days in Iran to be able to have a flight back home. Our goal here is to provide a short summary of rhinoplasty operation so our dear listeners can get a general idea about the operation. In order to get further information, you can visit Iranian Surgery website. Feel free to contact us for more information via WhatsApp or email. Hope you have enjoyed the podcast. Stay with us for more podcasts on Iranian Surgery website.